Hi, I'm Savannah Young, and I'm doing my medication administration. Alright, so for planning for medication administration, I have my environment interruption free by closing the medication room door and talking to colleagues to important information, and then keeping like no phones or having no phones around, and then following agencies um, no interruption zone policy. So now I'm going to start off by preparing my order to my MAR. My order is Jaguar J. Jones, allergic to penicillin, and MR or medical record number is 4176352. Jaguar J. Jones is allergic to penicillin. MR is 4176352. Alright, so I see the order for morphine sulfate 5 milligrams IM every 4 hours PRN in pain. And on my MAR, I see morphine sulfate 5 milligrams IM every 4 hours PNR for pain. So they do both match, so all documentations for legal prescription is included. So we're going to put that order to the side. And now we're going to do our first check for accuracy. So we have Jaguar J. Jones, who's allergic to penicillin, and we have morphine sulfate for our medication, which here is morphine sulfate 10 milligrams per milliliters. It expires the 12/20/2025, so that means it's not expired. And I'm gonna give 5 milligrams, so that means I have to give 0.5 milliliters in my syringe from the valve. So it is an IM injection, so we have to use 3 milliliter syringe, a 23 gauge 1-inch needle, and a blunt cannula. So first I'm going to start off with some hand hygiene, and then I'm going to clean off the top of my valve. Now I'm going to get the syringe without touching the tip of it, and my blunt cannula, and I'm going to twist that on. So since I am drawing up 0.5 milliliters, we're going to draw 0.5 milliliters of air first. Alright, and now we're going to stick that in the valve, and then push that air back in, and then draw up 0.5 milliliters of 0.5 milliliters or a half of morphine. I'm gonna flick the bubbles out. Alright, perfect. So now, since it is an IM injection, I am going to recap the needle, but first I'm going to show you the dose. It's 0.5 milliliters, or 1/2. I'm going to recap the needle by not touching that part, pushing it in. We're going to twist off this cannula. And we're going to put that in the sharps container. We're going to put on the 23 gauge needle. I'm going to twist that on. So now we have that, my morphine dose. So it's given every 4 hours. It's been around 4 hours. And PRN for pain. Jaguar Jones is in pain. So documentation, all elements for prescription is there. So we're going to do a second check for accuracy. So we got Jaguar J. Jones, allergic to penicillin. We have morphine sulfate in here, morphine sulfate right here. 5 milligrams, 0.5 milliliters in here from here. IM, which this is the appropriate needle and appropriate syringe for an IM injection every 4 hours. It's been around 4 hours. PRN for pain. Jaguar Jones is in pain, and all elements for prescription is there. So now I'm going to create a label. So I'm going to get some tape, and on this label I'm going to have Jaguar J. Jones' name, morphine for the drug, and the dose 0.5 milliliters. for 5 milligrams. Alright, and after I'm done with that, I am going to take that around my syringe. Alright, now I'm going to take this syringe, the MAR, some alcohol wipes, in my valve to Jaguar J. Jones' room. So now we're going to go in there. Knock, knock, knock. Hey, Jaguar J. Jones. I'm Savannah Young, and I'll be your nurse today, okay? I'm going to start off with 2 patient identifiers, which is Jaguar J. Jones, the MR 417-6352, 417-6352, okay? And I see that you're allergic to penicillin. I have penicillin right here. Is there any other allergies you would like me to help you with or ask you about? Okay, perfect. So I'm going to go ahead and get some hand hygiene and some gloves on. And I will also assess the patient before I give them any type of injection. I'm going to position your bed comfortably or to a working height. I'm going to lower your side rails. And I'm giving you a morphine shot for your pain today, okay? Put my goggles on. Alright. So now I'm going to do my 3rd check of accuracy before I give this shot for him, which is name Jaguar J. Jones, morphine sulfate, which is morphine sulfate in here, and from my valve. 5 milligrams, which is 0.5 milliliters in here, IM. This is the appropriate needle and syringe for IM. And then I have every 4 hours, which it has been around 4 hours. PRN for pain. Jaguar Jones is in pain. And documentation is all elements for a legal prescription is there. So now I'm going to come over here. I'm going to do a ventral gluteal IM injection. So we're going to have Jaguar J. Jones lay on their side. Okay, we're going to clean up the area. So before I clean up the area, I would assess for any bruising, edema, inflammation, and infection and stuff. He does have good muscle integrity, so this is a good spot to inject that. I'm going to start off by cleaning with an alcohol wipe. And this is IM, so I'm going to spread the skin. Take off the needle first. Spread the skin. And this is intramuscular, so when I'm going to go in at a 90-degree angle. And I'm going to aspirate. I don't see any blood, so I'm good to go to draw. Alright, perfect. I'm going to take it out just like that. And I'm going to straight put this in the sharps container right here. Glove is stuck to the thing. Sharps container. Alright, Jaguar J. Jones, let me get you up and position back comfortably. Take off my gloves. I'm going to do some more hand hygiene. I'm going to go back to my nursing station, okay? And I'm going to document this whole process. I'm going to come back in around 15 minutes to see how you handle that medication. And I'm going to assess you. Is there anything else I can help you with? Okay, you rise your bed, get your handles all situated. Have a nice day, okay? And that's the end of my medication administration checkoff.